next speaker, I would like to inform audience that for those who are interested, there is a poster board available in the registration desk if somebody is looking for clever PhD students or postdocs or somebody of young people is interested to apply for some nice applications in the area of nanotoxicology. It's possible to inform via this poster board. So I would like to now introduce next speaker, which is Reeves from Australia, from Australian Pesticide and Veterinary Medicine Authority, and please give a lecture.
Thank you very much, Mr. Chairman, and good morning, ladies and gentlemen. It's a great honour for me to be invited to speak at this conference. This is my very first trip to Prague, and so I'm very grateful for the conference organising committee for this privilege. I'm also looking very forward to the excellent program that is planned over the next couple of days. I was delighted to hear that the Learned Society has taken a name change to the Research Infrastructure Quality Nano. It certainly reflects the quality within nano safety research, which is so very important. Every now and again, one has an opportunity and privilege of gaining a helicopter-type overview of the innovation landscape. I'm pleased that the title of my presentation today provides me with that opportunity and privilege. It is certainly very nice. I think it's appropriate that I address at the outset science research driving innovation and future growth. We've just heard regarding smart growth. Smart growth certainly strengthens knowledge and innovation as drivers of our future growth. I think this graphic displays it fairly nicely. Ongoing improvement to the quality of our education, promoting innovation and knowledge transfer, strengthening the performance of the resource sector, making full use of information and communication technologies, and of course ensuring that innovative ideas can be turned into new products and services that create growth and jobs. I'm really referring to the development of a value proposition, and a value proposition encapsulates all of the reasons and motivations that compel a consumer to buy the product or service. And irrespective of the invention, the single greatest challenge in its commercialisation is the development of a value proposition. So to summarise, we need to strengthen the knowledge triangle, we need to support the development of these new technologies, and we also need to take care of the demand side of policies with smart regulation, but also with keeping the public informed of what it is we're doing. We must not lose sight of the fact that for every euro spent on invention, there's something like 10 times that spent on developing products, and at least 100 times spent successfully selling and distributing that particular product. And I must stress that is best practice. The outline of my presentation is shown up here. We know that nanotechnologies promise benefits in a wide range of applications, from material sciences to healthcare, food, cosmetics, chemicals, information and communication technology, and the list goes on. I won't be discussing many of those at all. Rather, I'll be discussing, just taking you for a fairly quick tour through some of the materials, the possibilities to date. I'm also going to address the challenges. And even though the challenges can be scientific, political and societal, my comments are going to be addressing just the scientific challenges, which are primarily definitional or conceptual in nature. Before I do that, I'd just like to spend one moment just to reassess the nanoscale. We have seen this so many times. I've tried to take a different position on this, different perspective, showing the nanoscale in terms of wavelength of radiation. So basically this image shows that the visible light has wavelengths ranging from approximately 400 nanometres to 700 nanometres. Beyond that we have infrared, and of course beyond that we have microwaves and radio waves. The scale does not allow those to be shown on this scale. In the foreground, what we have is ultraviolet radiation from about 380 nanometres down to 10 nanometres. And again, not on the scale, we have X-rays and gamma radiation. So where do these common nanomaterials fit in relation to these wavelengths? We see that the liposomes, fullerenes and carbon nanotubes are very much in the ultraviolet radiation wavelength group. Others such as dendrimers and quantum dots are down in this sort of area here. So in fact they are in the longer wavelength of the of X-rays. Moving on to the possibilities for nanomaterials, this image attempts to capture the evolution towards increasingly sophisticated nanomaterials and technologies with time. There are many examples of passive and active nanomaterials already on the market, but despite this, there's quite an intensive R&D activity going on at the present time, and so I've included those in this particular image. And the 5 groups of nanomaterials that I'll be discussing are shown here. Passive nanomaterials, active nanomaterials, nano devices and sensors, robots and factories. I've selected nano-pesticides as an example of passive nanomaterials. These nanomaterials tend to do one or more of the following things. They can increase the apparent solubility of poorly soluble active ingredients. They protect the active ingredients against premature degradation. And they also allow a controlled release of these agents. So the nanomaterials, the nano-emulsions and the dispersions shown here are associated with higher efficacy, reduced hydrolysis, reduced volatilisation of the active ingredient. They also enhance the mobility and the faster degradation by soil microorganisms. Controlled release are represented here by the polymer-based nanomaterials and the porous hollow silica particles. The polymer-based nanomaterials can control, or the rate of release of the active can be adjusted by changing the proportions and molecular weights of the polymers. Porous hollow silica particles are used as carriers of active ingredients. They obviously shield from ultraviolet, thereby producing some change to the degradation profile, and they certainly allow for controlled release. Active nanomaterials are certainly very well represented in nanomedicine. Since the emergence of nanotechnology, there's been many attempts to exploit in medicine nanotech to overcome many of the persistent problems in conventional medical treatments. Liposomes, of course, have been used in drug delivery now for more than a decade. The magnetic nanoparticles are used both to deliver drugs if the size of them are 50 nanometers or thereabouts. They're also used for hypothermia. They tend to be the smaller nanoparticles of about 5 nanometers in size. Gold nanoshells have applications in cancer therapy with infrared hypothermia. Dendrimers are relatively new in terms of drug delivery, that is. Quantum dots have been used for localization, as you know, and carbon nanotubes are now being used as nano-vector systems, and they too can be used in a similar fashion to what gold nanoshells are used. Worth saying something more about targeted drug delivery. This particular image, panel A, oops, sorry about that. Panel A is simply showing a mass of tumour cells with angiogenesis, formation of new blood cells. Panel B is actually represented a nanoliposome, and the pink bodies are the active ingredients. Basically, if you're standing on the inside looking out, what you see are the polar head groups, which are all the of the phospholipids, which is all the green. The yellow in here, and there's some yellow out here, is the photoreactive lipids, and there's also some hydrophobic pale blue photosynthesizers, and there's also some orange, you may see them just here, which are the hydrophilic photosensitizers. So we have a array of laser photo-triggering this. Basically, there's a couple of mechanisms by which this is the membrane here, the bilayer, is broken down such that the pink drug payload can be released. Nano-clays have a very large number of applications. You may have seen recently CSIRO in Australia have a commercial product now called Phoslock, which is for locking up phosphate, prevents the blooming of blue-green algae in waterways. In fact, it was used in the 2000 London Olympic Games for that very purpose. Nanoclays are also used for the delivery of agrochemicals. The example shown here is actually a DNA nanobiohybrid. What we have is inorganic hosts with the two layers. The silver molecules here are magnesium. The light blue molecules are aluminium. The hydroxide, of course, is the oxygen, is the red, and the hydrogen are the small blue molecules. So basically, these have now under investigation for the delivery of, for gene therapy, in fact. The DNA can enter cells by phagocytosis. DNA molecules are released either in the acidic environment of the lysosomes or through reverse ionic exchange within the cellular fluid. Just wanted to touch on devices. The example I've given here is the nano patch. It's actually very tiny, something the size of a postage stamp, has thousands of projections which are dry coated with vaccine. Basically, the nano patch is applied to the skin and as soon as the vaccine enters the liquid beneath the skin, it very quickly dissolves, and what we see is this is a projection here. These little dots are vaccine being released. They stimulate, I'll just walk you through the sequence here. Basically, the sequence is the antigen-presenting cells in the skin of the Langerhans cells, stimulating the T cells. The killer T cells then activate these B cells, which in turn activate the plasma cells to produce antibodies. We think this is going to be, it's currently under research, should be commercially released in 5 or 10 years. We think it's going to be very important because at the moment there's something like 2 million people die every year from diseases that can be prevented by vaccines, particularly in developing countries. And this sort of technology, firstly, it allows for, well, it doesn't require needles and syringes. It does away with the need for a cold storage chain, and it can obviously be used without very much clinical experience, because you're simply applying a patch to the forearm for a couple of minutes and removing it. I wanted to touch just briefly on one particular sensor. Some of you will be aware of smart dust. Basically, it's a wireless sensor network, which is a collection of these very tiny and cheap sensor nodes. They can communicate up to a distance of tens of metres. There's many applications for these, and you've probably read about them. They're used in, for example, for fire detection. They're used in animal habitat monitoring. The military use them, for example, even though it's not very much in the literature. It is possible to use these particular devices. They're around about the size of a grain of sand, and they can be spread across a battlefield such that military are able to watch enemy move across a battlefield, and they can do that from another country because as shown here, the signal is actually transmitted to a satellite and back to a laptop, which can be done basically anywhere in the world. In agriculture, what we can do is use it in precision agriculture. So, for example, this diagram is meant to sort of show that there could be something going on with this particular patch of a field, and that would be treated, for example, with a pesticide, or it may need irrigation, and so there is no need to treat the remainder of the field. This, of course, saves on, it saves the farmer costs, but it also saves the environment. Nanorobotics are used in medicine, and no doubt you've all read about these. Some appear to be more fanciful than others. One such report that I read about recently was the detection, diagnosis and therapy of subclinical bacterial infections in food-producing animals. This has two really major benefits, I should say, should it ever come into reality. One major benefit is the fact that it would overcome a lot of emergence of antibiotic resistance, extending the effective clinical life of currently available antibiotics. But the second benefit relates to food safety. And of course, if less antibiotics go into food-producing animals, then our food will be so much the better for it. The image shown in on this particular slide is a red blood cell, and this is a nanorobot treating a cell individually in vivo. More information is available on that particular device on the website, should you need it. In terms of nanofactories, it would appear at the present time as though much of what is happening with nanofactories is going to rely very heavily on our current understanding of molecular biology. The top panels on this particular slide refer to DNA as a molecular self-assembler, so it's not used for the information but rather as a structural template. We're looking here at ribosomes and protein synthesis, and again molecular assembly, and finally we're looking at the molecular transport in the cytoskeleton and the transport of cargo along these microtubules is very much like molecular conveyor belts. And at the present time, we're seeing a lot of this type of molecular biology being utilised. in some of these nanofactories. Schematic at the bottom shows cell-free protein-producing gels. It gives some insight into the molecular manufacturing that may occur into the future. Basically, the artificial four-armed DNA junctions are shown here, as is the genomic DNA fragments shown in red. DNA ligase is shown in blue, and it forms a gene-containing hydrogel polymer. These in turn are produced in these molds, which are shown here. They in turn are then taken across into this test tube in this particular depiction. Things are added, cell extracts are added, such as ribosomes, RNA polymerase, and the gel functions as an in vitro protein biosynthesis unit. So it's, in a sense, it's very much what you would expect from a food nanofactory sometime into the future. I now want to change tack a little bit and just touch on some definitions. You are all familiar with these. I've sourced them from ISO TS 80004-1. Arguably, the four definitions shown here are probably the key ones that we need to concern ourselves with. I don't intend going through those because I'm sure you've all seen them previously. It's probably important to point out that there is a lack of consistency across in definitions across expert bodies. For example, the ISO 14644-6 from 2007 includes liquids such as droplets and micelles in emulsions. By contrast, the American Chemistry Council exclude micelles and single polymer molecules from their definition. And it just highlights the fact that definitions are not consistent across bodies. Also, there's a lot of improvements going on. It's acknowledged, for example, in health and safety that there is no cut-off at 100 nanometres. And so the science is still emerging, and so is our capacity to measure and characterise nanomaterials. And as this goes on, we are going to see some of these definitions change accordingly. I should point out also that regulatory agencies don't work entirely by these definitions. Regulatory agencies have legislative mandates to discharge, and the criteria they use for regulating nanomaterials can be in excess of what we're seeing in some of these definitions. Development of a ontology for nanomaterials is a very important goal that has yet to be attained. And ontology would allow the uniqueness of specific nanomaterials to be established. It would also allow the equivalency of two nanomaterials to be established. A major challenge with trying to establish an ontology is the fact that many practitioners from diverse backgrounds would all like to see that their specific requirements included in an ontology, and this presents a tremendous challenge when it comes to trying to develop an ontology for nanomaterials. The characteristics that I've shown up here are actually taken from that produced by a group doing cancer research. Clearly, that sort of approach works fine for that particular group of people, but it would not work fine for other researchers. Some researchers, for example, have proposed that the ontology be developed in terms of the biological interaction of nanomaterials. I note that there was a workshop in Paris in 2012 organised by the International Council for Science and its committee. And they recommended a two-phase project in terms of developing a nanomaterial ontology. The first phase would determine the requirements for a description system for nanomaterials that takes into account the needs of as many scientific and technical disciplines and user groups as possible. The second phase would use that information to develop a potential list of the minimum characterizations, or characteristics I should say, that meet as many of the requirements as possible. Just make a brief comment on labelling of consumer products. Consumer products, of course, of things such as food, cosmetics, plant protectants, detergents and textiles. Nano-labelling has been the subject of many headlines in the press. There's always two sides to an argument. Consumers require additional information on labels for making informed purchasing decisions. Industry, on the other hand, argue that because nanoparticles are not in principle dangerous by their very nature, undifferentiated labelling could stigmatise and malign nanomaterials in general. And it's for that reason that a simple nano label could be interpreted as a warning symbol, while a label with extensive information could lead to over-information. There's a situation in Australia in 2012 when Friends of the Earth published a list of sunscreen products which were claimed not to contain any nanoparticles such as UV filters, titanium dioxide and zinc oxide. Tests later showed that these indications were not always reliable and that these alleged nano-free sunscreen products did indeed prove to contain nanomaterials. I'll finish by just mentioning some of the regulatory challenges. I list them here. I will actually be talking about these on Friday in the regulatory session, so I don't plan to go into the details now. But it's very heartening to see that the challenges that I've posed up there are very similar to the list that we saw previously. So when we looked at the snapshot of innovation and the regulatory level and some of the items that will be addressed, and certainly there are many items in that regulatory field that will need to be addressed. So in closing, I would like to acknowledge the very significant contribution of Dr. Michelle Nick Reinl to the preparation of this presentation. And thank you very much.
Thank you very much, Phil, for this overview talk and the challenges and the opportunities. We have now time for questions already now. If somebody has questions specific about pesticide authority view in Australia, well, or to the talk, now is your opportunity. I see a question over there. Elise, please present yourself, who you are and where you come from.
I'm Elise Fitzans. I'm a visiting scientist at the University of Lausanne's Institut Universitaire Roman pour Santé de Travail, and also a doctoral candidate at Geneva School of Diplomacy. I'm fascinated by the question of how to define nanoparticles and nanomaterials for regulatory purposes, which often looks very different than the way it looks in the world of the lab bench, for example. And I would like to know what you think of this idea that was launched by the Royal Commission in the UK in 2008, that the key issue is really functionality and not size. And I ask this because I know that a lot of regulators like numbers, and think that it's easy, that if something fits in a size box, it's one thing you regulate, and if it's too big or too small, you don't, or you don't worry. What do you think of this notion around functionality? Thank you.
Thank you for the question. It's a very good question. I made the point that regulatory agencies have legislative mandate and legislative criteria that must be satisfied. As far as size is concerned, in the agency where I work, for example, we use size for nothing more than it's a tick box on the application form. And the purpose of that is to draw our attention to the fact that what is being submitted may possibly be a nanomaterial that needs to be treated somewhat differently. Just because the box is ticked does not necessarily mean to say that it is between 1 and 100 nanometers. For example, the differences between using dynamic light scattering and transmission electron microscopy, for example, can produce very, very different results. I will be showing one of those on Friday. But for example, if you were to use TEM, certainly the material would be in the nanoscale. If you use DLS, it would have a size of 300 and something, whatever, nanometers, and it would fall out of the scope. So really, I believe it's nice to know if it's if the applicant feels it's in the nanoscale, to highlight it. Certainly for our reporting, our minister, for example, wants to know very, very rapidly, I'm talking about, within 5 minutes, how many nanomaterials could be in the system or could be approved, and so we need a database, and that sort of information is handy. But really it comes down to, as you said, the functionality. Regulators work on risk, basically, and risk is a function of hazard and exposure. And it's the hazard part which fits in with the functionality, but of course it's also the size which goes hand in hand with the biodistribution and the systemic exposure. I'm not talking about the exposure to people, which is quite different, where you can wear protective clothing, etc. And so the regulator must do the risk assessment based on functionality and all those types of things. I hope I've answered your question.
Are there other questions?
Hi, my name is Natasha Lewinsky. I'm a postdoctoral researcher at the Institute of Work and Health in Lausanne. And I have a follow-up question on your comment about saying that when size is a tick mark on the form. And so what do you mean when you say that it will be evaluated differently?
I'm referring to the fact that if we have knowledge in advance that the material is a nanomaterial, we can be aware of that. The evaluation is really no different to what it would be for a conventional chemical. The difference is partly with public perception in particular, and we don't wish to overlook the fact that a nanomaterial was evaluated from a public point of view. The risk assessment itself is not necessarily different. I will be addressing some of that on Friday in a regulatory session, because obviously if we're talking about pesticides, for example, we're not just talking about the chemistry, we're talking about public health and we're talking environmental health. And so there are many, many different issues to take into account. And something as simple as agglomeration could change everything. And perhaps what we're dealing with isn't even a nanomaterial. It may have been produced as a nanomaterial. By the time it's placed in a syringe or into a mammal or a plant, it may no longer be a nanomaterial. And so we've got to look at that, the persistence of that characteristic. I hope I've answered that.
Thank you.
Thank you very much, Phil, for these responses to these questions. You will stay here for longer, for the entire week, so there are plenty of opportunities where you can learn more about the Australian pesticides and agricultural field, the questions, if you have more questions to him, and especially, he mentioned already the talk that he will give later on a more specific issue, less of an overview, but more specific, and that's also something to look forward to. Thank you again, Phil.